So we presented at EHA 2025 our study entitled POLARGO. This was a globally conducted randomized trial of R-GEMOX versus R-GEMOX plus polatuzumab vedotin in the treatment of patients with relapsed or refractory large cell lymphoma. After an initial safety run-in phase to confirm the tolerability of the combination of POLA with R-GEMOX, we then moved into a randomized trial, one-to-one randomization with 255 patients randomized. Eligibility criteria included relapsed refractory large cell lymphoma, including transformed indolent lymphoma, one or more prior lines of therapy, and patients had to be both naive to polatuzumab vedotin, as well as be ineligible for stem cell transplantation. What we found was that the study was positive for our primary endpoint of overall survival with a stratified hazard ratio of 0.6, which of course translates to a 40% lower risk of death. This was alongside improvements in quantitative overall survival, improving from 12 to 19 months for median OS, improvements in median progression-free survival, complete response rate, and overall response rates were seen as well, with a doubling of CR and a doubling of ORR seen with the addition of polatuzumab vedotin in these patients. What I would say the clinical significance is really references the role that polatuzumab vedotin can play in the management of relapsed refractory large cell lymphoma. Currently, we do use POLA-based treatment for patients in the second-line setting and beyond. The only approved combination to date has been in combination with bendamustine and rituximab. As we continue to learn about the deleterious downstream effects of the use of bendamustine, particularly as relates to negative impacts on subsequent T-cell engaging therapies, including CAR T-cell therapy, there's been a need for a better backbone, a better partner for polatuzumab that can drive response rates and outcomes without jeopardizing subsequent decision-making. I think that the POLARGO regimen represents just such an advance and gives us as oncologists a new tool for leveraging polatuzumab vedotin in the treatment of relapsed large cell lymphoma without jeopardizing outcomes from subsequent CAR T-cell therapy.